before I get to that, I do want to share a quick update on COVID-19. At this point, over 2.4 million people have been tested in Massachusetts. Over the past week, there have been around 19,000 new individuals tested every day. That's up compared to the 7-day average of new individuals tested each day, which was around 9,000 in mid-June, 12,000 in mid-July, and around 15,000 in mid-August. That means we're doing more. We're also seeing an increase in the number of repeat tests performed on individuals. This indicates that people continue to request tests more than once over time and are taking advantage of the testing resources that are readily available across our Commonwealth. The 7-day average for the number of total tests conducted has been above 30,000 tests for most of the past 2 weeks and is currently averaging around 35,000 a day. That's up from a 7-day average for the total number of tests conducted in mid-June, which was around 11,000, in mid-July of around 16,000, and in mid-August of around 20,000. That increase shows that we're continuing to make progress in increasing access to testing in Massachusetts. Additionally, the Broad Institute announced a partnership with over 100 colleges and universities to provide testing for students and staff, and so far, the Broad has conducted almost 400,000 tests through this initiative and plans to continue to do robust testing as schools welcome folks back to campuses to help stop the spread of COVID as well. And we're certainly grateful for the partnership that we've established with the Broad over the course of the past several months and look forward to continuing to work with them as we go forward. The state's positive test rate's around 1%, and it's been in that range for the past few weeks. Our hospitals are reporting, Lieutenant Governor and I were on the phone with him this morning, no issues with managing the care of COVID-19 patients and other patients in need of medical services and procedures. We've seen good progress and will continue to monitor data and pay close attention to higher risk communities. While the statewide statistics are in a great place, there still are several communities that are struggling with the transmission of COVID, and that's why we introduced a new system for color coding and providing ramped up resources and stricter enforcement in the communities that have higher levels of COVID. Continue to update that map every week so that residents can remain vigilant and informed about what's going on in their city or town. And while we're certainly pleased with the progress that we've made with respect to the spread of COVID, everyone needs to keep in mind that we only get to this point through the actions of every resident, employer, business, local official, state official, basically everyone here in the Commonwealth. It's taken an incredible amount of discipline, hard work, and sacrifice to get to this point with respect to COVID, and as we head into the fall, we should certainly not let up. No matter the numbers, everyone needs to be vigilant about wearing a mask, practicing good hygiene, and avoiding, wherever possible, large group gatherings, especially unorganized, unsupervised group gatherings. This highly contagious disease will be with us until there are better treatments or a vaccine, and we'll have to keep working to beat it down every day. Throughout the pandemic, as I said before, state government continued to carry out the work the people of Massachusetts expected to do and to serve the people of the Commonwealth. For the MBTA, that's meant many things, but one of them is trying to take advantage of this time and the low ridership and the limited traffic to make upgrades to improve service and save taxpayer dollars along the way and get work done quickly.